It's time to focus on seniors with Helping Seniors TV. The television show designed to make you aware of senior issues and needs, as well as to acquaint you with the resources available to help you age in place and with dignity. Now, here's your host, Joe Steckler.
I'm Joe Steckler, and welcome to Helping Seniors, the television arm of Helping Seniors of Brevard County. Our show is designed to provide you on information on how to develop your own aging and care plans. Our topic today is care management. And joining me is Cathy Rowlands, President of Care and Care Manager of Total Long-Term Care Consultant Services. That's a lot of words, but as you listen to what we're going to talk about today, I think you will see it's extremely important that you understand what Cathy is going to talk about. She's well-versed in all aspects of care management. The names are changed, and she's going to talk about that a little bit today. So with that said, welcome, Cathy.
Thank you very much, Joe. Glad to be here.
I tell you, it's my pleasure to have you. I have been in this care business now for 27 years. I've been director and president of chairman of board of a couple of nonprofit organizations, started a couple of them, and I know the value of good and accurate information, and more importantly, what you do. For years, we called it case management.
Correct.
Now we call it care management.
Yes, we do.
And why do we call it care management now instead of case management? Why do you think?
Why do I think? Is because a case, in my opinion, is a medical or episode, and that's what the hospitals, that's what Medicare defines it as. As a care manager, we manage the individual's care and sometimes their life throughout the period that we're involved.
That's exactly right.
That's right.
Yep. So what is Total Long-Term Care Consultants? What do you do?
Well, Total Long-Term Care Consultants, we do assessment. We give make a plan, information. We implement a plan. We monitor the plan, and we're also an advocate for individuals out in that are out there in the healthcare field.
Do you find, well, initially as I got into this business, there were not many people that did what you do. I think over the years, in the last 15 to 20 years, the need for care management has become more prominent. People understand what could happen, what would happen if we didn't have people like you in the business. Can you address that a little bit?
Yes, I can. When I've been a long-term care facility consultant. I'm a licensed nursing home administrator in a couple states. And when I decided to leave the facility management, I read an article in Wall Street Journal about geriatric care management. And I thought, man, I think I can do that. I have a strong medical background. I was a pre-med major, med tech, worked in biomedical research and teaching hospitals throughout the U.S. And I have a master's in healthcare administration. So I thought I could do that. My husband and I flew to Phoenix for one of their national conferences. This was back in probably the late 90s, 1996, 97. And I joined their organization, and there was a National Geriatric Care Manager Association. And I joined that, became a certified care manager with much effort because I wasn't a nurse and I was not a social worker. But now that organization has grown, and the goal was to help the long-term disabled individual, whether they were an adult. I have a young man who's in his 20s. I have had gentlemen with head injuries that were in their 40s and 50s. And then you get the more mature, older person that you deal with that's lost their mental or physical abilities. And what we do is assess, like I said in the beginning, assess their needs, develop a plan, implement the plan, and we follow it through by being an advocate, changing the plan as necessary with the goal of maintaining the person in the environment that's the least restrictive and most cost-effective situation.
That's
And it meets their needs.
saying a lot. That's saying a lot. You said that you had a client with a head injury.
Yes, I did.
How old is this person?
Well, this person that has had a head injury, I think he just turned 60.
Does he have any family?
He has he was taking care of his elderly mother and his elderly aunt when she passed away. I was interviewed. There was a bank involved. They were the trustees. We were interviewed at the time. He chose me. The family and the bank chose me to do the job. I've had this gentleman for over 12 years.
Okay, so that our viewers understand, I think examples are a case.
Right.
Shows what care management is. And I think if you will just describe for our viewers what you do to ensure that this person has the care. Now, is one of the elderly people he was taking care of, are they still alive? Or is he by himself now?
The young man that I'm talking, he still lives at home.
And who's at home? He's taking care of somebody?
No, his parents died. We are managing him.
Okay.
They put the bank, who obviously was not a care manager, put in caregivers round the clock. Well, he could see how much money this guy's is obsessive with his money, and he got upset. So we came in. I got a speech therapist involved whom he had not seen that taught him how to communicate.
Okay.
Keep logbooks, which he does every day. He writes down everything that's been done. We set up his medicines on a weekly basis. We've got the physicians that he sees. He sees a neurologist, a psychiatrist, and an internist. And we make sure that medical issues are addressed immediately. We monitor him every week. We got him involved. He was working as a volunteer with one organization, and they closed up. So I got him involved in another organization, which he worked with for a long time, would go and work every day. Now the best thing we did was get him involved in a organization that's the Melbourne Parks and Recreation. And we did that because I knew somebody there the first time around who worked for me when I ran a nursing home. We got this guy involved, and he goes every single day, 4 hours a day, to work. They gave him an office. Keeps up his self-esteem. We see one of my care managers sees him once a week at the place where he volunteers, and I have another nurse that goes and sees him at the house, make sure his medicines are right.
Does he have a volunteer job, or does he get paid for it?
No, he's volunteer because he's collecting disability, or was collecting disability.
But it gives him something to do.
It gives him something to do. It gives him purpose in life. He's able to communicate with people. He has difficulty communicating because he's got a head injury. So you have to, sometimes things come out the opposite way.
Okay. So he gets the disability?
Yeah, he gets some disability, and he fortunately has a special, what I did, he had trust, and I met with a lawyer, and we created one of the trusts into a special needs trust.
Okay. So your services are paid for out of the trust then?
My services are paid for out of the trust at this point.
Okay. I don't want to get into your personal business, but I hope there's some way that you can convey to our viewers that they know that you got to get paid. There's too many people that are under the misapprehension that the people that do what you do tend to clean out people's trust, clean out their bank accounts, and do it. And that's not true. What we have to do is help people, educate them on why it's important for a care manager to be involved. there was another part of the question series that I wanted to ask you, and it had to be when we're talking about the management of people. When there's so many things to understand, and I think it's important now if you can help our viewers understand the care that you provide to this man prevents other things from happening. You follow me?
Correct.
Okay. How about telling them about that?
Well, that is a problem, especially with somebody like him who personally likes the attention. He would get calls from people that would try to sell him something on the telephone. Well, I finally trained him to hang up on the phone, and he does that now. He hangs up on it. The other safeguard I have is that he does his log. Every day he does a log. So I can tell whether somebody's been there or not and can follow up on it.
How often do you check on him, Cathy?
We check on all of our clients once a week.
Okay.
Once a week. I think it's imperative, whether it's 15 minutes, depends on what has to be done.
Yeah. I know that there's a whole, because I just did a recent show with an attorney, an elderly attorney, and we're talking about guardianships and talking about estate planning, Medicaid planning, but you're involved in all of those types of things.
Correct.
How does the correct use of a care management person set aside or mitigate against the establishment of guardianships and how you keep things from going wrong?
Well, I'd like to meet with people early, in their, after they retire, or meet with a financial planner to let people know what options could potentially be out there, what the long-term care continuum looks like. And if you don't, and who pays for it, and if you don't set up have all your legal documents in place, your power of attorney, healthcare surrogate, will, trust, whatever you do, so that if something does happen, the proper person can be called in. Because if nobody has a healthcare surrogate and something happens, a neighbor calls and says, well, this poor lady has fallen on the floor, we don't know what to do, and nobody's come around. Well, then they call DCF or 911, which they're supposed to do. I don't have a problem with that, but usually that will start the ball rolling for guardianship. And I guess everybody knows even though I am a registered guardian, I'm not a proponent of it because it costs a lot of money to do it. The ward has to have a lawyer. The guardian has to have a lawyer. They have to go through an examining committee, which costs around $1,000 just to declare them incapacitated.
Right.
And then the cost of maintaining the guardianship, the legal part of it, through the court system.
So
to prevent that, I would suggest that people know that we are out there as care managers of resources. For instance, if somebody has a stroke, okay? And it might be prudent for the family members to look up in the yellow pages or look on the website for aging life care professionals and get a certified care manager. Call them up. Have them come in and assess what the situation is, what the individual needs to maintain, their health and well-being. They can pay for an assessment, which can be from $500 to $1,000, depending on if they want it. I tell people in my business, you need to retain me for either $500 or $1,500 and pay me by the hour. And I can be on call whether you need me or you don't need me. We can be called if there's a crisis because we prevent hospital readmissions or admissions. I don't like to send a person to the hospital if I don't have to.
I agree.
Yeah. So what we do is try to address it with our primary care doctor or a walk-in clinic, whatever, we can get, something done right away. Or if they're not feeling well, instead of waiting till they get very sick or get your bladder infection that goes septic, we call the doctor, try to get it treated.
I spoke to a group of guardians. It was about 4 or 5 months ago. You were there. What is that group? What was that group? Was that
Well, that I started that group many years ago because I wanted to get care managers together. And I was in and out of it, and now I happen to be president of the Space Coast Guardianship Association. We were formerly part of the Florida State Guardianship Association, but when I was absent from the organization, they split off. And we have our own organization now, and we're able to keep a fund that we use for indigent wards that need facilities.
But you call it a guardianship organization, but they're really care managers.
There's not only care managers in there, when you were there, there's facility owners, ALFs, there's lawyers, there's all the people that go into the management of somebody's life there.
That's a good point. Who are some of the professionals that you work with as you establish these plans and these routines for people that to keep them from having to have guardianships established or put them in some element of law which costs them a lot of money, which they don't need to do? Who are some of the people you work with?
Well, if I was called in, I would assess the individual for what their physical or limitations are, but also I would ask to see the legal documents. Ask them to see whether they've got a power of attorney, healthcare surrogate. If they don't, and I feel that the individual could still execute those documents, I would refer them to 3 lawyers, and they can take their pick of who to go to, and that are state planning lawyers that would draw up those documents.
Are you a proponent of the durable power of attorney?
Yes, I am.
Good. I have never done a show like this or with any attorney where I have failed to mention a durable power of attorney, because I think that is a document that everybody should have, and they should understand that you don't go to Office Depot and pull a durable power of attorney off the shelf, because a good durable power of attorney will be anywhere from 12 to 20 pages, and because it lists specifically all the powers that you want to have granted in that piece of paper.
That's correct. And people that have had their power of attorneys or legal documents executed before October of 2011, they need to be redone. And a lot of people don't realize that.
And these are things, the value of a care manager being involved, Cathy, is that you know the rules, you know the rule change. It's just like elder law attorneys. It's much less expensive to get a care manager involved than it is to get an attorney involved at a lower level of care. There are things that you will pick up as a care manager that you have to refer to an attorney because it's not within your realm to do. But that's what good care managers do.
That's right. And I would never consider doing financial advice or anything like that. You need to call a financial planner or somebody that they deal with, the broker, whatever. You need to do that. You need to have a lawyer. I don't touch any of that stuff, period. End of story. I don't do, we don't do, some care management organizations do have their own home health care agencies. Right. I do not do that. I don't do that. So you need to get the proper, use agencies and refer on.
But when you're doing care management, how often do you pick up abuse of the elder people that you come in, say you come into a case, it's pretty easy for you to see where there might have been financial abuse, maybe children misusing the parents' money or taking the parents' money without the parents realizing what's happened. Do you have situations when you get a case like that, you refer them to an attorney?
You bet. I would definitely.
Is that a lot? Is it something that you encounter? Is it a lot or not?
Not really a lot. What we encounter a lot, more often than not, is that people don't know what to do. Like I'm trying to deal now with a case that the husband died and there was an insurance involved and everything and left the wife. And the children don't know what to do. They're so confused.
Right.
So I'm trying to methodically sort it out for them, getting the daughter, and I think I've convinced the son to let us be more involved, and we'll tell you what we think needs to be done, and you can tell yes or no, but allowed to work with us.
But what do you find that a more common thing is that you got involved in care management when you're called into families that have, say, second marriages or third marriages, and the children of the first marriage want certain things to happen, and while maybe the father wants to honor his wishes to his second wife, the children are not in favor of it. And I know of 3 or 4 situations that we've been called in on this just very recently. You encounter is these the type of crisis management type things that you get involved in?
I've been involved in it. No, a lot of it is the DCF. I have a case where the family called me. I've had 2 in the last 2 weeks. The family called me a year ago, over a year ago, both families. And they talked to me. I gave them some advice and everything, but they don't want to pay for it. I mean, a lot of people think that their insurance, Medicare or Medicaid, Medicare in particular, should pay for this.
It doesn't.
It does not. And the new health care plan, they axed out long-term care benefits because they realized how much it was going to cost. And, so anyway, I got involved in both of those cases because DCF got involved. And DCF, in one of the cases, they called me on a Saturday and said, I know you're involved, and what are we going to do? They picked up these people. They came in and they called 911, so they took both of them to the hospital, husband and wife to the hospital. So I went down, intervened, brought them back. Well, the second time this happened, the wife went, she had some psychotic issues that needed to be addressed, which were never addressed by the primary care physician or anybody. She ended up in the emergency room. Fortunately, I got there before they were ready to Baker Act her. And I was able to get her into placement into a small group home. And that's where we are now. And I was able to apply for VA aid and attendance for her because she's military, as is her husband. And now we're going to work on getting him aid and attendance, and we're going to bring him home with in-home care.
Did they finally realize then that they needed to pay for your services?
They had to pay for the services, and the children finally realized that they needed to pay for the services.
So how do care managers basically get paid?
Privately.
Is it all private pay?
It is private. There is some long-term care insurance policies that will pay for you, but they only want you to visit like once a month or something like that.
Which is insufficient.
In my opinion, it's insufficient because especially if there's nobody overseeing and monitoring and being a resource for the caregivers. We are a resource. My phone is available 24/7. And I try to, give the caregivers support.
Do you have any idea of the number of people being served? Let's just say in Brevard County by organizations such as yours. Are there a large number of people, or is it?
I would say I have no idea because there's several care management services, available in the county. And I strongly advise people to, just like a lawyer or a doctor, you interview them and see how you interact with them. But I would say if you had 2,000 people, that would be huge. That's a huge number.
Wow. That's
not very many out of the.
That's
insignificant.
We probably are just touching the tip of an iceberg.
Touching the tip of the iceberg. I think people have to have to learn to realize what the value of a care of prospective planning. And
well, that's what's so hard, Cathy. It's just like we become accustomed to all of us on Medicare. Everything we get, all the services are paid for. We forget that there are services that are not covered by Medicare or Medicaid, and are extremely valuable services. And just my own experience in working with people, I know that people that do care management bring an element to the care situation, what I call elements of care, which are extremely important that are underutilized.
That's right. And it keeps you from using, Medicare, if they would pay us, and there is some movement toward that recently in the listserv that I've read, that but they're going to have to be licensed. And I met with my primary care physician and asked him if he would bring me into the group as a referral for him. But he looked at all the paperwork that is required by the Medicare to document my services and to get reimbursed for the services, and he told me it wasn't worth it to him.
I could understand that.
Yeah, right. I would like to get involved in these, what do they call them, home healthcare management companies, what do they call the Medicare, MA Melbourne Associates of Brevard.
Okay.
That's one of the groups.
Okay. There's things that we need to look at.
Yeah, we need to get involved. We need to enlighten them about the value of our services.
Okay. We're out of time. But I want to thank you, Cathy,
Oh,
for
you're
being
welcome.
here today. And I want to thank you, viewer, for watching today's episode of Helping Seniors on Care Management. I think it's extremely important that we know more about it. I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.